This podcast is for informational and educational purposes only and is not medical advice. Always consult with a qualified healthcare professional before starting any peptide, supplement, or wellness protocol. Welcome back. Today we are talking about peptides that are especially powerful for women. Whether you want better energy, hormonal balance, weight loss support, improved skin, deeper sleep, improved libido, or faster recovery, peptides can make a major difference. Women experience unique shifts in hormones, stress, metabolism, and aging, and peptides can help support those changes in a gentle but meaningful way. So settle in, take a deep breath, and let's walk through the most effective peptides for women and exactly what they can do for your mind and body. Let's start with peptides that support female hormone balance. One of the most commonly used peptides for women is Kisspeptin-10. Kisspeptin helps regulate the hormonal signaling process between the brain and the ovaries. Women often notice better mood, better libido, more stable cycles, and improved overall hormonal balance. Some women also report more emotional stability and a reduction in symptoms related to hormonal fluctuations. Another helpful peptide is sermorelin. Sermorelin helps stimulate natural growth hormone release, which often begins declining in the late 20s and 30s. Growth hormone is critical for metabolism, fat burning, skin health, energy, and muscle tone. Women using sermorelin often report improved sleep, firmer skin, reduced belly fat, and better recovery after workouts. Now, let's talk about peptides that support weight loss and metabolism. One of the strongest peptides in this category is AOD 9604. This peptide is known as the fat-burning fragment because it helps trigger fat metabolism without affecting hunger or cortisol. Women often use AOD to target stubborn thigh fat, lower abdominal fat, and overall body fat that becomes harder to lose with age or hormonal changes. Another metabolic peptide is MOS-C. MOS-C works at the mitochondrial level to increase energy production. Women often experience better endurance, more motivation, better mood, and more consistent energy throughout the day. It is especially helpful for women who feel tired, sluggish, or unmotivated despite eating well and exercising. For women dealing with insulin resistance, weight loss plateaus, or metabolic slowdown, peptides like tesamorelin can also be incredibly effective. Tesamorelin helps target visceral fat, which is the deeper abdominal fat behind the muscle wall. Women often report a smaller waistline, better energy, and improved body composition when using it consistently. Next, let's talk about healing and recovery peptides that support active women. BPC-157 is one of the most powerful healing peptides. It supports gut health, reduces inflammation, and accelerates healing in muscles, tendons, and ligaments. Women with chronic pain, injuries, autoimmune issues, bloating, or gut sensitivity often experience fast improvement with BPC. TB-500 is another healing peptide that works beautifully with BPC. TB-500 helps reduce inflammation, improve mobility, and enhance tissue repair. Women dealing with joint pain, hip tightness, shoulder discomfort, or workout-related soreness often feel looser, more flexible, and more comfortable while training. Now let's talk about peptides for skin, hair, and anti-aging. One of the most loved peptides for women is GHK-Cu. GHK-Cu is a copper peptide that supports collagen production, improves elasticity, and repairs damaged skin. Women often report brighter skin, tighter pores, reduced fine lines, and improved texture. It can also help with hair growth and scalp health. Another powerful anti-aging peptide is Ipidolon. Ipidolon supports telomere health and may help slow the cellular aging process. Women using Ipidolon often report better sleep, improved mood, more energy, and a general sense of youthfulness and vitality. It can also help regulate circadian rhythm, which is incredibly important for hormonal stability. Collagen peptides are not technically prescription peptides, but they play a huge role in skin and joint health for women. Collagen helps maintain firmness, reduce wrinkles, and support bone density. Many women use collagen peptides daily for hair growth, nail strength, and improved skin elasticity. Now, let's move into cognitive and emotional support peptides. CMAX is one of the best peptides for mental clarity, motivation, and focus. Women dealing with brain fog, stress, or mental fatigue often notice fast improvements in concentration and productivity. CMAX helps women feel more organized, more alert, and more mentally sharp. C-Link is the counterpart to CMAX. C-Link helps reduce anxiety, calm the nervous system, and improve emotional balance without sedation. Women often describe it as calm confidence in a bottle. It is especially helpful during stressful months, hormonal fluctuations, or periods of high emotional pressure. Another brain support peptide is dihexa. Dihexa helps with cognitive processing, memory, and verbal fluency. Women who need strong mental stamina for work, creativity, or parenting often find dihexa extremely helpful. Let's shift into peptides for libido and sexual wellness. One of the most effective peptides for female arousal is PT-141. PT-141 works on the melanocortin system, which controls desire and intimacy. Women often report improved libido, increased sensitivity, and overall higher levels of sexual interest. It does not rely on blood flow. It works on the brain's desire pathways, making it especially effective for women who feel disconnected from their libido due to stress, hormones, or lifestyle demands. Another peptide that helps women with blood flow and physical arousal is VIP, also known as the vasodilation peptide. VIP helps increase circulation, which may support lubrication and physical pleasure. When used with PT-141, many women report a fuller, more complete improvement in their intimate life. Now, let's talk about peptides for stress, mood, and emotional resilience. KPV is a powerful anti-inflammatory peptide that also supports gut health and the gut-brain axis. Because gut inflammation and stress often go hand in hand, women using KPV often feel calmer, more emotionally stable, and less bloated. KPV supports digestion, reduces reactivity, and reduces inflammation throughout the body. NAD+ peptides and NAD precursors support cellular energy and mitochondrial function. Women often experience better mental clarity, deeper energy, improved metabolism, and better recovery. NAD also plays a role in emotional well-being and aging gracefully. Now, let's explore peptide stacking strategies for women. A basic wellness stack might include MOS-C for energy, BPC for healing, and GHK-CU for skin. This combination supports metabolism, recovery, and beauty from the inside out. A more advanced stack for women looking for weight loss and fat burning might include AOD9604, tesamorelin, and MOTS-C. AOD helps burn fat. Tesamorelin targets deep belly fat. MOS-C increases energy and athletic ability. Together, they support a complete metabolic transformation. A hormone support stack for women might include Kisspeptin, Sermorelin, and C-Link. Kisspeptin supports healthy hormonal signaling. Sermorelin improves metabolism and recovery. C-Link calms the mind and reduces stress. Together, they help women feel more balanced, stable, and emotionally grounded. Another stack focuses on anti-aging and beauty. GHK-CU, Epidolon, and collagen peptides create a powerful trio. Women often notice improved skin, deeper sleep, better energy, and a more youthful glow. Women who want to focus on libido often combine PT-141 with VIP and Kisspeptin. PT increases desire. VIP increases blood flow. Kisspeptin improves hormonal signaling. This combination can help restore confidence and intimacy. Let's talk lifestyle integration for a moment because peptides work best when paired with healthy habits. Peptides amplify what you already do. If you work on your sleep, peptides make it deeper. If you lift weights, peptides make recovery faster. If you eat clean, peptides help your metabolism run more efficiently. They are tools, not replacements. They magnify your foundation. Women often ask how long it takes to feel results. Many peptides work quickly. CMAX works within minutes. PT-141 works within hours. BPC works within days. AOD and MOS-C begin working within the first week. Growth hormone peptides like Sermorelin or tesamorelin take several weeks to show full results. Longevity peptides like Epidolon work over cycles but create deep, lasting improvements. The most important thing to remember is that peptides are designed to support your natural biology. They work with your body, not against it. They help you feel more energized, more balanced, and more confident. They help restore what stress, aging, hormones, or lifestyle have taken away. Every woman is different, and the right combination should be tailored to your unique needs. But when done correctly, peptides can truly change how you feel every day. This podcast is for informational and educational purposes only and is not medical advice. Always speak with a qualified healthcare professional before using any peptide. Thanks for listening, keep learning, and stay curious.